medicine, when we think of regenerative medicine, we're thinking about, what we're doing at the biochemical level, hacking the biochemistry really to produce changes that slow down aging at the level of the cells, right? So that's what, I think of when I think of regenerative medicine. And there's a lot of different things that, that we do. Part of it is the lifestyle factors. The other part is a really deep dive into the biochemistry to see, where there's inflammation in the body, to make sure, the thyroid is optimized, that gut health is what it should be, that the hormones are balanced. And of course, there's all of the different things in our day-to-day life. Lifestyle factors, making sure that our sleep is optimal, stress reduction is addressed. Obviously our nutrition, super important to make sure that it's, anti-inflammatory and, being used properly to fuel our bodies. And then obviously micronutrient deficiencies, because those are things that cause problems at the levels of the actions in the body, can't occur as they should if you don't have the tools you need, to perform those biochemical reactions.